You know, if you've ever had a doctor mention angiogram and angioplasty in the same sentence, it's so easy to get them mixed up. I mean, they sound almost identical, right? But here's the thing, they're not. At all. One is the test, and the other is the treatment. So let's clear up all that confusion and really break down what each one does for your heart.
And look, understanding this difference is absolutely crucial. Because even though these two procedures are closely related, they perform two completely different jobs. They've honestly revolutionized cardiology. But to really get why, we've got to know what they are first.
Okay, if you only remember one thing from this whole explainer, let it be this. An angiogram is the test, and an angioplasty is the treatment. Think of it this way. The angiogram is the diagnostic scan that finds the problem, and the angioplasty is the hands-on procedure that actually goes in and fixes it. Test and treatment. Simple as that.
To make this crystal clear, we're going to use an analogy that I think really works. Imagine an angiogram is a detective showing up to investigate a crime scene. And the angioplasty? Well, that's the plumber who comes in to fix the pipes once the detective has figured out exactly where the problem is. Let's see how this plays out.
So first up, the detective, the angiogram. This is an imaging test. A special dye that shows up on an X-ray is injected, and presto, you get this detailed roadmap of your heart's arteries. It's basically like a live traffic report for your bloodstream, showing exactly where everything is flowing nice and smooth, and, more importantly, where there might be a major traffic jam. Now, what happens if that detective finds a serious blockage? Well, that's when you call in the plumber, the angioplasty. This isn't about taking pictures anymore, it's a treatment. Using a similar thin tube, the doctor can physically go in and open up that clogged artery to get the blood flowing properly again.
And here you can see it all side by side. It's the detective's evidence and the plumber's beautiful handiwork. On the left, that angiogram image is pointing right at the culprit. That's the blockage. And then on the right, you see the aftershot. The plumber has come in, placed a stent, the pipe is cleared, and blood can flow freely. Problem solved.
So, when exactly does a doctor decide to call in this detective? I mean, it's not for every little ache or pain. There are actually very specific situations that call for an angiogram.
The reasons really run the gamut, from extreme emergencies to planned checkups. If someone's having a heart attack, an angiogram is an urgent all-hands-on-deck procedure to find and fix the problem immediately. But it can also be a planned test if someone's symptoms just won't go away with medication, or maybe before a big heart surgery, to give the surgeons a clear picture of the arterial landscape. And, you know, sometimes it's just the best way to get a final, definitive answer when other tests just aren't clear enough.
But, our detective has a bit of a limitation. A standard angiogram creates what's called a luminogram, a fancy word, but all it means is that you're basically just seeing a shadow of the blockage. It tells you that there's a narrowing, sure, but it doesn't really show you what's going on inside the artery wall itself.
To get around that, cardiologists have some amazing tools. This, for example, is an image from an intravascular ultrasound, or IVUS. Now, instead of just seeing the shadow, this is like putting a tiny camera inside the pipe itself. It gives the doctor a full 360-degree view of the artery wall, showing exactly how thick the plaque is, what it's made of. It takes the investigation to a whole new level of precision.
Okay, so we've covered the what and the why. But what does it actually feel like for a patient to go through one of these procedures? Let's take a walk through that journey.
The whole process is actually remarkably streamlined. First, they'll give you some medication to help you relax, and they'll numb up the spot where the catheter goes in. That's usually your wrist or groin. Then, that super thin catheter is gently guided up to your heart. The detective work begins. Dye is injected, x-rays are taken, and here's the cool part. If they find a blockage that needs fixing, the team might just switch gears right then and there and call in the plumber for an angioplasty. Afterwards, the catheter comes out, and you have a short recovery period. It's really incredible when you think about the shift from major open-heart surgery to these minimally invasive techniques.
Now, when it comes to the angioplasty, the plumber's job, there are two main tools in the toolkit. They can use a tiny balloon that gets inflated to just squish the plaque up against the artery walls, clearing the path. But much more common today is placing a stent. This is a tiny wire mesh tube that acts like scaffolding to permanently prop the artery open. It's designed to make sure that blood can flow through for the long haul.
All right, like any medical procedure, these aren't completely risk-free. Of course not. But it is so important to look at the actual data, to understand the balance between the huge, often life-saving benefits and the potential, but pretty rare complications.
So let's start with the big picture, the headline number. The rate of any major complication from these procedures is less than 2%. That is incredibly low, especially when you consider that these are often interventions that are literally saving someone's life. And if we break it down, the risks fall into a few categories. The most common things are pretty minor issues right where the catheter went in, like some bleeding or a hematoma, which is basically just a bad bruise under the skin. Some people can have a reaction to the dye. The really serious events are extremely rare, but you need to know about them. The risk of a stroke is about 0.07%. A heart attack during the procedure, even lower, at 0.05%. For simple diagnostic angiogram, the overall mortality risk is just a tiny fraction of a percent, 0.08.
Now check this out. This is a detail that really matters and shows how things are always improving. The risk of major bleeding changes a lot depending on where that catheter goes in. Using the femoral artery in the groin has about a 2.5% risk. But, and this is a big but, using the radial artery in the wrist cuts that risk almost in half, down to 1.3%. It's a perfect example of how techniques evolve to make these procedures even safer.
So, after going through the what, the why, the how, and even the risks, let's just pull back for a second and summarize the big picture on these absolutely vital tools in modern heart care.
Okay, here are the key takeaways, the things to really lock in. Angiogram is the detective, angioplasty is the plumber. You always need the detective before you can call in the plumber, and a lot of the time, they both show up on the same day. These are common, very safe procedures, and just knowing this distinction really empowers you to understand what's happening with your own health. I just love this quote. It frames these procedures perfectly. That little catheter is like a powerful key that can unlock a diagnosis and a treatment for the heart. And so the challenge, for doctors and for patients, is to use that key wisely, for the right reasons and at exactly the right time.
You know, at the end of the day, knowledge is power. It really is. Understanding the difference between a test and a treatment, a detective and a plumber, it changes you from just a passive recipient of care into an active partner. It lets you ask smarter questions and make more informed decisions. So the real question isn't for me, it's for you. Now that you know